We've all heard the saying, when white Americans get a cold, black Americans get pneumonia. In Michigan, black residents are just 14% of the state population, but we represent 40% of coronavirus deaths. In North Carolina, black residents are 22% of the state's population, but we represent 35% of coronavirus deaths. In Illinois, black residents are just 15% of the state population, but we represent 43% of coronavirus deaths. This result is attributable to healthcare disparities. My name is Miriam Heard. For the past 11 years, I've been privileged to provide legal representation to hundreds of clients with disabilities. I've helped them to secure supports and services using Medicaid, Social Security Disability, and other public benefits programs. Now I'm a senior attorney for the National Health Law Program. What do I mean when I use the term healthcare disparity? I am referring to a higher burden of illness, injury, disability, or even mortality by one group relative to another group. The effects of this deadly virus have been exacerbated or worsened by disparities that have been in existence for decades. What are some of these healthcare disparities? Segregation has restricted people of color to crowded urban neighborhoods for years, and those neighborhoods are more likely to have substandard housing and less likely to have access to green spaces or grocery stores that have healthy food options that are affordable. Social distancing guidelines are harder for people of color because we are overrepresented in service industry sector jobs. We're more likely to rely on public transportation. We're less likely to be able to work from home. Higher rates of chronic, serious health conditions make the coronavirus potentially more dangerous for people of color. Conditions such as diabetes, asthma, heart disease. Here's another healthcare disparity. African Americans are more likely to be uninsured, and that translates into increased challenges for people of color to access testing and treatment for COVID-19 symptoms. What steps can you take to protect yourselves and your families? Gain access to health care. Investigate the Affordable Care Act. There is generally an open enrollment period during the year when anyone can go on and find a health care plan and determine whether they may be eligible for a subsidy to help them pay health care premiums. But if you have a qualifying life event, such as losing your job and losing your health care that was offered through your employer, you have a new special enrollment period that gives you 60 days to enroll in a new ACA plan. To find out more, go to the website www.healthcare.gov. At that same website, you can find your state Medicaid agency and begin the application for Medicaid process if that's appropriate. In every state, Medicaid provides coverage for families and children, pregnant women, the elderly, and people with disabilities. In some states, Medicaid has been expanded to cover all income or all adults below a certain income level. If your benefit is being denied, terminated, or reduced, you have the right to a notice. And this right is constitutional, so it doesn't matter which state is administering your Medicaid. You are required to get a notice that tells you when this will happen, why this will happen, how you can file an appeal or a challenge to that adverse state decision. You also have the right to a hearing. Prior to the hearing, you have the right to examine the case file, all the documents, all the records that will be used at this hearing by the state agency. You have the right to call your own witnesses, to present documentation. You have the right to cross-examine witnesses who've made a decision, an adverse decision in your Medicaid case. Make sure that you file an appeal that clearly states that you would like a hearing about the decision that was made in your case, and you do it before the deadline that is given in your notice. The African American community has an increased risk of infection and an increased risk of experiencing serious illnesses if we become infected with coronavirus. Learn about the resources available to gain access to health care, including but not limited to the Affordable Care Act and Medicaid. Please stay safe.